Hi, everyone. We're just waiting for folks to join. If you can hear me okay, just go ahead and type a note in your either question or chat box so that I know you're hearing me. Not seeing anything yet. Let's see. Okay, perfect. Oh, great. I'm seeing them come in now. Great, you can hear me. Well, fantastic. Well, I'm just going to mute you for a couple minutes. We're just waiting for folks to join. We'll give people just a couple more minutes to get on the line, and we'll get started soon. Hi, for folks that are just joining in, we're just giving folks a couple minutes to sign in. We're seeing a lot of people come on right now, so we'll maybe start at like 9:02, but I will put you on mute in the meantime, and we'll get started soon. All right, everyone. Well, thank you for joining us this morning. I wanted to just give a quick update for this session. So my name is Dr. Elizabeth Baca. I'm a senior health advisor in the Governor's Office of Planning and Research, and I've been working with our Global Climate Action Summit team and partners at the Department of Public Health to make sure that we are able to integrate health throughout the Global Climate Action Summit. So really excited to see that there's been so much interest and interest in participation and interest in making commitments to the summit and really integrating health in a very tangible and really very extensive way. So before I get started, just for the webinar, unfortunately there were too many people, so we weren't able to do it as a meeting where everyone could chat. But you have on your screen a question box or a chat box. So if at any point you have a question, feel free to just type in a message and I'll be kind of monitoring that. So we'll go ahead and get started. So what we'll cover in this hour is a little bit of background in terms of who's been involved with the summit and the background as to why the summit is so important at this moment. We'll review this different leadership, the summit, the key leaders who've been helping to direct and really the vision behind the summit. And then take a step and look at how we're integrating health throughout the summit and beyond. We'll actually dive into some of the specific challenge areas, which are really the core of how the summit is being organized. And another really important part is all the affiliated events that are happening. We've had hundreds of applications and a really tremendous wealth of events that are going to be happening along the same time. And then I think the last is just some conversation around some opportunities for involvement and then answering any questions in terms of questions and answers. So why now? I think this is one everyone on this call probably is already on board with this. But I think one of the key things is that 2018 is actually a very consequential year. We are going to be having the COP again in December, and this is a really big opportunity for countries to be really taking stock of their collective climate progress. These results are going to inform the next round of the national pledges in 2020. So this is a really key moment. I think the other thing is the recognition that although we've done a lot has been accomplished, and there are a lot of success stories out there, the key thing is that countries really can be doing more. And so the summit is intended to underscore the wealth of the actions, everything that's already been taken, but that recognizing together we can also do more, and to call on countries to make even more ambitious commitments. Again, this really goes back to the point around the challenge areas and the commitments that are going to be a big part of the summit. So the other thing is that the summit is going to be a very momentous day, but the intent is not for what's happening at the summit to stay at the summit. The intent is for this to really be a catalyst to moving and carrying on to other things such as the UN General Assembly and the next COP. And also the UN Secretary General's Climate Summit in 2019. And this is all with the goals, again, of getting countries to redouble their climate ambition by 2020. And I think everyone, again, on this call, I've talked with many of you, really recognize that now is the time. We need to step up. We don't have time to wait, given where things are at with climate change. And I think the other key recognition, especially with this, and you'll see this reflected in the advisory committee and all of the different partners, is that we need all of the sectors of society, and so that's including national governments, to really to live up and to get to this collaborative spirit that we saw in Paris. And they're just tremendous opportunities. And so this is also going to be really an opportunity to showcase a lot of the great work that's happening across cities and states and with businesses and civil society, and to seize this moment. So in terms of the summit leadership, I think this is, work in the Governor's Office of Planning and Research. We all know that Governor Brown has been a tremendous leader in work on climate change and in work on protecting the environment, even from the previous administrations when he was a governor for the first round. And he's brought this tremendous team together of co-chairs. And so Patricia Espinosa, who's the Executive Secretary of the UN with the Framework Convention on Climate Change, Anand Mahindra, who's the chair of the Mahindra Group, and Michael Bloomberg, who is the UN Secretary General's Special Envoy for Climate Action. It's really this tremendous brain power of thought leaders who've been working tirelessly to address climate change. And in terms of the advisory committee, and again, this really goes back to thinking about the vision of the summit and all of the parties that are going to need to be collaborating and coming to the table. So we have Mark Watts, who's the executive director of C40, Mindy Luber, who's the president and CEO of Ceres, Wael Hamdan, who's the executive director of Climate Action Network International, Andrew Higman, who is who's the CEO of Mission 2020, Aaron Kramer, President and CEO of BSR, Helen Clarkson, the CEO of the Climate Group, and Manuel Pulgar Vidal, who is a climate and energy practice at WWF and former president of COP20. So I think it's very clear when you look at the representation, it's a very nice mix of business leaders, of city leaders, of nonprofit leaders, and really everyone, again, who's been participating has just had a tremendous impact on climate and mitigation and action already. So that said, in terms of some of the day-to-day work, and again, we've had a number of you, we've had calls, questions on how all of the challenge areas are getting formed. I would say we're one team with many partners. From the state side, and this doesn't even represent, probably half of the different agencies and departments that are involved, but I couldn't fit them all in one slide. But this is just a sense of all of the different voices that we've been representing at the table in the decision-making process and how to bring this in. In terms of the partners on the non-state side, so all of the nonprofits and business groups and everyone else that's been mentioned, they too have been part of this in planning, in terms of planning committees and different challenge areas. So it's been really tremendous to get everyone coming together. And I think, with the summit, one of the things is that, the summit, again, it's really focused on action, on mitigation, on reduction of greenhouse gas emissions. But there's also this really unique opportunity to integrate health, as we were talking about. And, everyone on the call probably is familiar with the Lancet Commission on Health and Climate Change, that really it's one of the greatest global health opportunities of the 21st century. And I think in a lot of the work that's happened in climate change and health, in the past has been focused on some of the impacts, and we know that those are really important. But I think in terms of messaging and in action, it's also a real opportunity to think about the fact that these climate actions have health impacts right now in the here and now, and that's really a big part of what we're working on with this summit. This is a slide. So the Department of Public Health has been a great partner and has actually was able to help brief the advisory committee a couple weeks back. And this is one of their slides that was adapted actually from the Center for Disease Control, and Dr. Patz, who I think has gotten on the call as well this morning. But I think, it's just, again, to show that there are a number of health impacts. So, across the spectrum, and we recognize and see that those are important. But again, I think it's really also thinking about the opportunities and how some of these things specifically tie in from a co-benefits perspective with the different challenge areas. So to get to the challenge areas, again, it's really about stepping up to make major commitments. So bringing all the cities, businesses, nonprofits, and many other partners together. There really are 5 key areas where the summit is going to be focusing to spur climate action. That includes healthy energy systems, so really thinking about a global shift towards clean and equitable energy and mobility to advance climate progress and enable healthy people and places. Inclusive economic growth, so really thinking about climate leadership and transition for good jobs, as well as broad-based economic opportunity, resilient, inclusive growth. The third area is sustainable communities, and so this is really about how we build our, how do we build our buildings? How do we think and design our communities? What's the infrastructure? How do we really create places that are going to be healthy and livable and improve the quality of life for all? The fourth area is land and ocean. So if folks have been following, this is another one where food and forest and lands and the ecosystems, right? So those are all completely important in the global picture for thinking about climate change, specifically as we think about food supplies for a growing population. And then the last area is really transformative climate investment. So how do we really get to where we need to go? And this is thinking about investments that are mobilized on the scale to achieve the Paris Agreement and spur innovation. So to jump in a little bit on each challenge area, and I guess also that we're integrating health throughout. But the first one in terms of healthy energy systems. So again, the global shift towards clean and equitable energy, there are a number of ways to go down this path. A summit goal is really thinking about delivering a global shift in renewable power and transport that's aligned with what scientists say is required to prevent dangerous climate change. So there have been already a number of different groups that have come out and started to take pledges. I think healthcare, I see Kaiser is on the line, has been a real leader in the space and is doing a lot of work in this area. I think we're going to see a lot of additional exciting commitments coming in. This one has been really, Donna Hume with C40 has really been a leader in this group. And so one question that comes up a lot, we can always connect folks through the state leads, but Donna is actually, if you're interested in kind of making a direct commitment or pledge, you can contact Donna. I think in terms of this, one of the key things to think about is the health co-benefits. So again, we know that reduction of bad air quality, which is linked with what kind of power source we're using, is extremely important around reducing chronic disease, which includes, across the array of cardiovascular, respiratory disease, diabetes, cancer, dementia, all of those. And with that, you can also see the benefit of lower healthcare costs and fewer premature deaths. Now, one of the things is that we haven't put every single health co-benefit on here. We know there are countless, but I think that the key is being able to address some of the big things that are really key to highlight. And a couple questions that have come in. One is, can we share the participants of this call? I can definitely share that after the call, so everyone can see who is on the line. And then can we get a slide deck after this? And for sure, I can post that up on our website as well. So in terms of inclusive economic growth, again, just taking a little bit of a deeper dive into this challenge area. Again, and so these challenge areas are very are set. Some of the kind of nuances on some of the specific things commitments that can be made are still being refined. But I think really the key is thinking about the more ambitious climate commitments from the private sector, and that's around three particular areas. So reach 500 commitments to setting science-based targets. Again, that really key piece of science-informed practices. Build climate resilient supply chains in communities. Again, this is another one where we've seen healthcare do tremendous work as we think about health and the links with some of the challenge areas. And then make a just transition to climate-friendly economies. And so if anyone's interested in reaching out and hearing more, Kelly Gaio is the contact at BSR for that. And in terms of some of the co-benefits, I think, as a number of folks on the line are really engaged on the social determinants of health, or all the social, economic, and environmental factors that are really important to promote health from the very beginning. And so I think this one is one where, as we think about a just transition, it's really helping to ensure access to jobs, economic security, and less stress. And it's very, there's a lot of evidence and science around the improved mental and physical health that comes with those as a co-benefit. The third challenge area is sustainable communities. This is really thinking again about sustainable buildings and cities and all of the infrastructure to ensure clean, healthy, and livable quality of life for everybody. And so this one is really in places that cities can lead the way and to help deliver communities. So this is including transformation of transportation. So, thinking about active transit and mode shift, buildings, and then waste reduction that benefits all. And so there are three kind of key elements to these commitments. So one is transforming communities with community-driven climate projects, transition towards zero-emission buildings, and then advancing towards zero waste goals. And again, one of the things that we'll be messaging throughout within the Climate Summit is the co-benefits around active living and alternate transport modes. So that includes walk, bike, and transit role as well, in promoting physical activity and improving health. And then healthy buildings. We know that healthy buildings, there's been a lot of movement in looking at healthy buildings and many ways that can promote human health. And then in terms of zero waste, there are lots of different types of benefits, but food recovery in particular, for a lot of the food recovery efforts, has been tremendously important to help increase food security for those that don't have adequate access for food. The fourth area for land and ocean stewardship. So this one, and there have one of the things, and we'll talk about it, but it would be great to include looking at the website on a regular basis, or just at least signing up for the updates. But a lot of the commitments that are coming out have been announced, and there was a commitment recently that WWF released in the food space. But this one is really focused on forests, food, lands, and other ecosystems that play a critical role in mitigating climate change. And again, this is on the side of really thinking about a more resilient world, and in terms of meeting some of our needs as we have our growing population. So some of the specific summit goals that are in line with this is supporting healthy citizens and food systems, restoring and conserving productive and resilient landscapes. So how do we use the land that we have? And then some of the other kind of more technical and financing support to bring those tools to the new actors, and then transparency and business engagement and investment. So really, a very comprehensive approach to thinking about forests, food, lands, and oceans. And here we see, again, these are just kind of some of the high-level co-benefits, but, even as you're thinking about supporting healthy citizens and food systems, there's been some excellent work on healthier diet and transition to a more plant-based diet, less chronic disease. The other thing is preserving food resources. So land conservation has been important, making sure we can actually grow the food that we're going to be needing. And then oceans is another one in terms of the impact on economies and food sources for a lot of populations globally. So just to, again, highlight how many of these have direct health benefits through taking these actions. And then the last one is really about thinking more about investments. The investments are mobilized on the scale needed to achieve the Paris Agreement to really get to where we need to go in terms of a clean and resilient economy. So this one is really focused more on the investor side, and there have been a number of investors specifically in terms of interest in health. And so thinking about fiduciary duties to clients and beneficiaries, this is really about investment, corporate engagement, disclosure, policy advocacy. And, I think one of the things, again, is that this really kind of goes towards, in terms of co-benefits, specifically thinking about solutions that are related to resilience, and stable investments, again, are really important for economic stability, which is a very important social determinant of health. So again, it's a really unique opportunity in terms of building momentum to get to where we need to go in terms of climate action. The summit itself, so in addition to all of the challenge areas, so the way that the summit will work is there will be speaking engagements for high-level leaders from across the globe, really talking in more depth about each of the challenge areas and highlighting many of the commitments that attendees are bringing to the summit with very ambitious goals, and highlighting the participants. The other thing is that there will also be a health breakout session that we've been working on. So although we're working on integrating health within each challenge area, and as we mentioned, there are a number of different co-benefits topics in terms of direct links to health. We are also going to have a health breakout session at the summit, which again will also be talking about the connection between health and climate change and a lot of the opportunities for action. And I think the other thing is just, again, as I mentioned, this is really being seen, the summit is really being placed in this more global context of all of the things that are happening. And so, again, G7, which we've had at the Global Climate Action Summit, Climate Week, and then COP. In terms of affiliated events, I wanted to go ahead and transition over to that. And I am going to, I see Carrie, so I will promote Carrie in a minute, but a number of you are actually going to be doing or have been involved in planning health affiliated events and other health events. And so a big part of the summit is actually leveraging all of this momentum. So we had around, I think it was 600, it was over 600 applications to host events. And so very exciting. It's a range. Some of them are going to be, really inspired by art and in films and across the range of things that are happening. And they'll be taking a place across San Francisco and beyond. So even in other countries, others will be hosting events. We're not only looking at things during that week, which is really important, but there are great opportunities before the event, such as the Climate Adaptation Forum that's going to be hosted in California, and other conferences that'll be happening after and then alongside the event. We will have health co-benefits, as I mentioned, are related and integrated in a number of the different events. And then just to highlight some of the things, the events right now are actually, they've all been approved and they're moving forward. We're just waiting for some of the official paperwork. So they should be posted on the website in the next couple, probably next week or two as they get finalized and finalize all the paperwork. But just to highlight a couple, there will be some specific health events that are mainly focused on health. There are other things that are going to be definitely touching on health, so carbon pricing, healthy food systems, air quality. There'll be a science day, so bringing together a number of the scientists who are leading in this space, discussions on climate security and migration, specific events on oceans, forests, and clean transport. So really a huge host of different things. And I wanted to go ahead and invite Dr. Linda Rudolph to say a few words about one of the health events that she has been helping organize. Linda, are you there?
I am. Can you hear me?
We can.
Great. So I've been working with Healthcare Without Harm, the UC San Francisco Global Health Group, and Robin Rothman and Naomi Baylor are on from those two groups, the Global Climate and Health Alliance and the U.S. Climate and Health Alliance, to organize a Global Climate and Health Forum that will be at UC San Francisco Mission Bay campus on September 12th. The overarching theme of the forum is climate action for health, health action for climate. We really want to look both at what the role of the health sector is, public health, healthcare systems, and health professionals in addressing climate change, mitigation, adaptation, and resilience, and where there's opportunities for integrating health and co-benefits into climate action in all other sectors. So we have an exciting lineup that's starting to really come together. Our morning keynote speaker will be Dr. Srinath Reddy, who runs the Public Health Foundation of India. We'll be hearing from Kaiser and Dignity Health, who, along with the Lung Association, have been important sponsors for us, and the Glazer Foundation is another important sponsor. Other confirmed speakers are Maria Nera from the World Health Organization and Rachel Kite from Sustainable Energy for All. And we're hoping to really have a good integration of people that can address climate and health action from the local to the global level, including indigenous people that represent indigenous populations, and that really help us understand the interconnections between health, climate change, and health equity and environmental justice. We also have Wael, who Elizabeth mentioned as being on the Summit Advisory Committee, is another one of our confirmed speakers. We'll be having panels that address subnational and national climate and health policy, decarbonizing the global healthcare supply chain, panel on climate adaptation and resilience from a health perspective, climate smart healthcare, energy, health and climate change, food and agriculture, health and climate change, and climate and health communications. And we'll also be presenting commitments from health organizations that address the overarching goals of the larger Global Climate Action Summit. So I think I'll stop there. And anyone who's interested in learning more about the Global Climate and Health Forum can contact me, and I'll put my email address in the chat box. Hello?
Hello?
Oh, is Elizabeth there? Carrie, is that you? Carrie, if you're on, I don't know where Elizabeth is, but maybe you want to talk about your event.
Hi. It's oh, good. That works. I will. Hopefully, people are still on the line. Can you guys hear me now?
Yes, we can hear you now, Elizabeth.
Okay, perfect. I don't know what happened. It somehow it booted me out, so I called back in. So sorry about that. Let's see. So Carrie, I did promote you if you're on. We were hearing feedback from you. I'm going to unmute you and see if you are there now.
Hello?
So strange. There must. Yeah. Hi, Carrie. Are you there? Carrie? There must be something with audio. Well, we'll have to skip Carrie's sharing, but I think one of the things, so in addition to all of the work that Dr. Rudolph was mentioning, Dr. Nadeau is going to be hosting a special session specifically for children and climate change and health. So I think that's going to be a really exciting session happening, I believe, on the 13th. So in addition to all of the different affiliated events that are going to be happening, I think it's a great opportunity to participate. And I think that really leads into opportunities for engagement. So I know that Sarah was asking about, who will be invited to the summit. I think one of the big things is that for participation in the summit, it's really thinking about bringing proof of progress and or reports on past commitments that folks have made. So really thinking about city leaders, business groups, nonprofits with very large kind of cohorts, and making new commitments to action to reduce emissions. So not everyone will be just based on the sheer size, but not everyone will be able to, who participates in the health events necessarily come to the actual summit itself, but there will be a lot of opportunities through the other events that are going to be taking place. And in terms of thinking about participation specifically for the Global Climate Action Summit, it's really going to be thinking about mobilizing your communities and networks to make and bring bold pledges to the summit. So if you're working with, if you have different networks that are working on any of these components within the challenge areas, feel free to reach out to me and I can connect you with the different groups. We have a number of folks who are already making commitments that are on this call. The other thing is, I think, recognizing the broader vision for climate communications and themes of Climate Summit, and specifically integrating health messaging. There's a lot of opportunity to be lifting up what's happening through op-eds, through social media, press releases, and other announcements, bold announcements. The other thing is contributing and sharing resources. So we have just the number of folks that we have who've been reaching out and are interested in supporting. We want to put together a resource guide because there are going to be a lot of people coming to the summit, both from city and regional leadership to businesses and other key sector leaders that haven't thought as much about health. And this is a real opportunity to have some resources to share some of the best publications. I know many on this call are actually have been doing that work. And then the other opportunities, there will be live streaming events and the opportunity to host a party and to take action, and again, in terms of attending affiliated events. So I wanted to just also flag that the website is really a fantastic place to get updates. This is on healthy energy systems, again, across the different specific areas, and then also a lot of content that's being posted there in terms of the commitments that are starting to come in, and also in terms of publications, reports, and other things that are going to be really key. So the last thing, I was going to move to questions. I have a couple of questions that came in, so I have a lot of questions. So let me just see. One is, well, just to and also to share and lift up some really great things that are happening. So Jonathan Patz said that they have a new study coming out last week showing AC powered by fossil fuels will have mortality consequences, and it will be on NPR Science Friday this week. So that's fantastic. Another question is, would love to hear more about how toxic materials derived from petroleum play a role in health and supporting resilience. This one's an interesting one. It's not necessarily one of the kind of key focus areas in thinking about mitigation, but I have had a couple of conversations, and actually was just last week at a policy briefing on plastics and alternatives to plastics, which we know, they're derived from petroleum. So there is not as much in terms of content right now throughout the summit. But again, this is one where if there are events, this could be a good place to think about weaving that in. I think the other is maybe within the healthy building space. That would probably be the place that most of it would would come in. Linda, I'm scared to ask you to talk because the computer did something really weird, but I was going to see, I'm going to unmute you and see if you want to unmute yourself, and maybe if there's any opportunity within the health affiliated event that you're hosting.
We haven't talked about the use of fossil fuel derived materials in pharmaceuticals or medical equipment. We have talked about the more direct impacts of fossil fuels use, extraction, transportation, and combustion on health. I think Debbie's asking a really interesting question, and then I'm not, we're struggling with trying to put in everything on the table into a one-day summit. I suspect we may not have time for that, but I definitely think it's an important issue. And Debbie, I'd love to speak with you offline about how we might be thinking about that in relationship to the other things we're talking about in the summit, in the forum.
Great. Well, and I would say I think that's one of the other, in terms of even resources. As I mentioned, the brief, and there's a lot to also, I think, to start a conversation, to spur a conversation. I think since it's going to be such a packed day, I think it's hard to get into everything, but I think a lot of it will be, really starting to host some of these conversations and thinking more explicitly about the connection to health. I think that could be a great one in terms of even an op-ed or some other publications or blogs or posts or things like that. So should we try one more time with Carrie? Carrie, are you there?
Hi, can you hear me?
We can. Perfect.
Oh, that's great. Thank you so much, and it's great to be on the call, and thank you, Dr. Baca, for arranging this. It's a fantastic event. And we're very excited to be part of the affiliate symposiums. We are lining up an array of speakers across the globe, the United States and California, to talk specifically about kids and climate change and health. And I think this is, of course, a subject that is very important and touches people across the planet in terms of looking at those populations that are at high risk, and pregnant, maternal health as well as children's health will be the main focus of this particular symposium. We're looking at the role of pollution, the role of different aspects of exposures and how that affects the unborn as well as children in the key periods of life in which they are at the highest risk of having exposures affecting them for chronic conditions. We're also going to be having a great discussion, leaders from Gina McCarthy to people from around the world that have been working in this area for a long time with large birth cohorts and explaining those results to the public and what it means to them, both on the side of air pollution, water pollution, and importantly, how global climate change is affecting these exposures and extreme weather conditions, for example, and how that's affecting both the unborn and children. And then important, we're going to be looking at the interaction of health, global climate, and environmental justice. We're going to be working with community and policymakers, and they will also be attending the symposium. And we really would like to invite all of you for your input and engagement in this important symposium. We would like this to be sustained, and this is such a great event to happen in September, but importantly, we want to make sure that this message and the narrative continues as we continue to try to improve the lives of others and their health with global climate change happening. Thank you.
Great. And is it okay to share your email, or what's the best way to get in touch for folks that are interested?
Thank you, Dr. Baca. Please feel free to share my email. I'm at Stanford, knato@stanford.edu, and I'm available anytime. Would be happy to interact with others and talk more. Thank you.
Okay, great. Well, what I'll do is add both you and Linda to the slide, your email and contact email, so folks can get in touch with you both directly. And in terms of capacity, one question I know that came up actually yesterday is, are either events going to be live streamed, or recorded for kind of other folks to watch?
Yeah, great question. We do have full intention of doing live stream. We were able to get a room at the Four Seasons right across the street from the Moscone Convention Center on September 13th in the afternoon. We'll put out more details, but it will be live streamed. We will be having media there and some other groups, and we'd love to speak more to you and others about how to best make sure that the public sees what we present.
And we are hoping that we'll be able to live stream the Global Climate and Health Forum as well.
Okay, fantastic. So a couple other, couple other questions that have come in. Let's see. Just to reiterate, so Robin Brockman with Healthcare Without Harm, who's also helping to plan, wanted to mention that there's more information about the Global Climate and Health Forum. So folks can visit www.globalclimateandhealthforum.org. So that's for that affiliated event. Let's see. Looking at more. Question about, will the Caltrans report on health co-benefits be reported or presented? Not directly, it's not necessarily a plan right now in terms of the global summit. I think one of the things is that even though this is the California Global Climate Action Summit, it's with the eye towards this is very global and international. So there's been, we're really working on seeking balance between international and national perspectives. So that may come up based on some of the presenters that get selected, but not necessarily a key focus of the conference. And then Jenny was asking about a couple for Dr. Nadau's event, which we were able to get, and I will make sure to post both emails. I'll post the slides and we'll get them up on the OPR website. So, and anyone's always free to email me, and I can make sure to put people in touch with each other. Also, just to let you know, one of the other things is for any of the affiliated events that are touching on health, we'll be hosting a call, because I think a lot of this is also really the network. Again, it kind of goes to that collaborative and the partnership and moving things together forward. So we'll be hosting a call with all of those the leads for the different events. Let's see. Another question. Will there be some common messaging that's developed by your Office for Health Partners? So yes, Sarah, we have just been having some preliminary calls. I had wanted to put that in here, but we weren't quite at the place to share it yet. So we're having some conversations about health messaging. Ideally, that will be the case in terms of across the different challenge areas and messages that folks can use across the different affiliated events, as well as within the summit itself. So I would say stay tuned for that. I think we'll probably be reaching out to this group again pretty soon, because we would love to get input in terms of some of the messaging. I think, again, just this group has got a ton of really great background to be able to share. And then another comment came in, common health hashtag would be great too, exclamation mark. So yeah, that's fantastic. We can definitely think about that. I think one of the keys throughout all of the summit is really thinking about leveraging the networks. So even within here, with everyone on the call and with all of the other folks that are participating, there's a great opportunity to leverage social media and all the different platforms to get the message out. And agree, a hashtag or some common things help really have more of an impact if it's not all separated out. So another question: can you say more about planning for the health breakout? So this is one within the summit. Again, one of the things is trying to balance throughout all of the different presentations that are happening throughout the summit. One of the things that we did was, we've been getting recommendations on speakers from a number of different partners on potential health speakers. And right now we're in a place of trying to balance the messaging out. I would say some of the themes during conversations that have come out that have been important is thinking about data and how data, again, kind of really reiterating that importance of science-based as we make informed decisions. Some of the other key themes, a lot of the things that we've talked about or covered in terms of health co-benefits. I think the other thing that we've heard from a lot of folks is thinking about the direct impact to people that you know, these things are already starting to happen now, and being able to integrate some of that direct perspective, and then some of the other, you know, kind of high priority issues in terms of, you know, emissions and how that impacts health right now. But more to come on that soon as well. And then let's see, New Resource Medicine is in the middle of releasing a 5-week-long special issue on climate change and health, and so there's a link. So one of the other things I will do is add the links in, since a couple of things have come out from this call. So I'll definitely add those in for folks. And again, this kind of gets, again, at the resource. So if people have resources, please feel free to send those in. We're going to be collecting those to put them together as a guide across the different areas that touch on co-benefits and health. Is there a registration fee for the health as well as the Children's Summit? So I actually don't know that. So I will have Dr. Ndow and Dr. Rudolph share on that. I know that many of the affiliated events do have a nominal fee, and some are open to the public and some aren't. So I'll let you both answer that.
Yeah, Linda, do you want to go first? My answer is pretty simple. We do not have a registration fee. We'll not be charging for attendance.
Okay.
We do have this is Linda. We do have a registration fee, and we also have many scholarships for people that can't afford to pay the registration fee. And the intent is that our registration fee will basically go towards subsidizing people, particularly from lower and middle income countries that wouldn't otherwise be able to participate.
Okay, great. Great. One of the other questions is, when will the health session agenda within the main event be available for us to provide feedback on? I would say, in terms of providing feedback on the agenda itself, that is not necessarily going to be an opportunity for the Global Climate Action Summit itself. I think we've been getting input in terms of suggested speakers, so I think that will be more that once the speakers are confirmed, then we'll be sharing that online once those confirmations come in. I have so Dan Wu. So my partners at the Department of Public Health are going to be hosting an event in Solange. I'm trying to make you an organizer so that you can speak. And I hear some background noise, so maybe that is you. Are you there? No? All right. Sorry for the technical difficulties, you guys. GoToWebinar is usually pretty good. It seems like I'm not able to promote Solange, but Dan, I'm going to try to make you an organizer. It's not letting me make you an organizer. Well, maybe I'll read it out for you.
Okay, I'll just tell people, if you're interested, that the California Department of Public Health chairs a public health work group of the California Climate Action Team, and that group will be meeting next Tuesday, the 17th, from 1 till 3:30. And I don't know if somebody from CDPH can hear me to put a website up on the chat box where people could get more information, but it's next Tuesday from 1 till 3:30. And I think there will be some conversation about the integration of health into the various themes and challenge areas of the summit to get some additional input on that intersection.
Yes, perfect. Thank you. Yeah, and I don't see that here, but I will make sure to add that to, I'll add the link for the CAT as well. And just as Linda was mentioning, it's really to provide a similar background to today, and to hear to other health-related organizers, as well as other partners, potentially from some of the challenge area leads, and people that weren't able to join the call today. And so that's going to be here in Sacramento. So I will add the link to that to make sure that is available for folks. Another question that came in: are all affiliated events and initiatives encouraged to take on a health perspective? That's a great question. We would love all events to take on a health perspective. One of the things that we've been doing is reaching out to a lot of the partners. So for instance, some of the folks who are involved in the Healthy Green Building spaces, they were putting their event together, just talking about some of the health inequity. And so they were actually able to override that, which was, and basically to include that and change the course. So that was really great. The other events, again, this is one where if we are able to have resources, and I think this is really a key, and we've talked, and I've had a lot of conversations with folks, this is a great opportunity for a lot of the health partners to go to events that they maybe would not normally go to, because there are going to be so many terrific events happening throughout the week. And I think being able to have a health voice at the table is great. So it's not like a formal letter to everybody, but I think reaching out as much as possible. There was a question: any decisions on wanting conference-specific carbon commitment health co-benefit estimates? That is still a work in progress. We're waiting to see. We've had some conversations. So this question comes up from the interest in looking at if it's possible to do a calculation of the benefits, the health benefits from actual commitments made at the summit. It's still a work in progress. We have to see in terms of timing for commitments coming in, and we're having conversations, but more to come on that. Another question that came in: so what efforts are underway to organize commitments for strong climate action and advocacy by health organizations? So I think this is one where everyone on this call is really instrumental. So I think, leveraging your own networks. I know, Linda, I don't know if you want to mention some of the coalition that you've been working with in terms of kind of more specific. And then I would also see if Kathy Gerwig, if you're on the line still, if you would maybe be able to speak to some of that as well. So I see Kathy's there. I'm going to try to make you a presenter.
While you're making Kathy a presenter, this is Linda. Maybe I can just say a quick word. The Healthcare Without Harm is, in fact, working with a lot of healthcare systems and hospitals around the country on their healthcare climate challenge. That may not be exactly the right name, but that is organized effort to really ramp up the commitments from healthcare systems to doing the kinds of things that Kaiser is already doing to reduce their own greenhouse gas emissions. And then Healthcare Without Harm, the U.S. Climate and Health Alliance, UC San Francisco, Global Health Group, the Global Climate and Health Alliance, and the Public Health Foundation of India. We're all working together on developing a sort of global framework for climate and health action that we will be circulating broadly once we have a draft, and seeking additional input on what kinds of commitments and actions people in the health sector can take, and commitments they can make before and at the summit. So great. We will be sure to send that out and ask Elizabeth to help us share that with the folks on this call, as well as the many others in our networks.
Perfect. And Kathy, it looks like I was able to promote you to an organizer. Are you there?
Hi, can you hear me?
Yes.
Oh. Okay, and I was busy trying to call a different number, so I heard most of what Linda said, and that was a great overview. Was there something else you wanted from me?
Well, I think just maybe in terms of, because a couple of questions have come in terms of health providers. How do you interface with health providers, community, also faith-based? But I think, some of the work, I don't know if there's anything else you want to mention in terms of healthcare.
Well, just, through the variety of collaborations, it's a bit California-centric, but I'll just mention that with Healthcare Without Harm, we're forming a California Healthcare Climate Alliance, and that's a way for those of us in California to very specifically work on a public policy agenda. So it's through those kinds of collaborations with healthcare systems that we're reaching out to the community, to policymakers, to our own health plan members in some cases. So that's what I would add, is really a focus on those kinds of alliances and getting people connected into them.
Okay, great. Yeah, no, and I think, again, I think using this forum, will be any of those things that come out, happy to share and to promote all of that as we're leading up to the summit. Great. Thanks, Kathy. We should mention that Kathy, for those of you that don't know, has been a tremendous leader at Kaiser, doing a lot of the sustainability work. So thank you, Kathy. One of the other questions that came in was from Mark Horton. Will there be a discussion at the summit on the political and economic environments nationally and globally, and the likelihood of these environments supporting or frustrating our efforts to address climate change? Tough question. I think in terms of two of the challenge areas, they really are more focused on the kind of economic just transition jobs and economic in terms of investment and scalability, and really thinking about how do we scale to get to the type of action that we need to meet the Paris goals. So I would say that I think that yes, that discussion will be a part of the summit for sure. Let's see, other questions. Let's see. Lots of questions. You guys this is awesome. You guys are an active group. And I will send out this information. Last thing, Jonathan, health perspective, great question. Would be great if Maria and Nara can flag World Health Organization's priority of health in all policies approach important message. Yeah, I'm sure that will come up in the conference as well as we think about collaborative approaches. And then questions regarding emails, I will definitely share those with the group. And then the last question, is there any time left to try out best health climate messages on a few focus groups? Is Ed Maybach on this? So Ed is definitely on our list. We've had some conversations, so that was one he's offered to share. Gina McCarthy as well, and a number of other institutions have offered support. So I think this is going to be really, I think probably a follow-up call. Would love to bring this group together, and anyone who's interested in terms of some best messaging. A lot of folks have already been testing out these messages, so hopefully that will be at one of our next follow-up meetings from this. Any other questions? It's just, we're right at the hour. Again, sorry for the little bit of delay with technical difficulties, but we jumped right past those, and we're able to get through everything. So I'm not seeing any other questions come in. I think that, again, this is one of our first calls. As we get more information, we'll be hosting something again similar, just in terms of an update, in about probably 3 weeks, probably about every 3 weeks until we get to the summit. I think there's going to be, more emails coming from us in terms of resources. Again, we'll hopefully be hosting something in terms of putting together some messaging and some kind of kits or things that folks can use across all the different events that are happening. And then once, again, just making sure to sign up for the website updates. But this is actually, you guys got this email because we've all been in touch. We have a separate listserv specifically for health interested partners. So feel free to always share if there was anyone who wasn't on this that should be. We are really excited about this, and look forward to working with everybody on here for the next couple of, I guess it's weeks now, but months. So On that, I will thank you for the thanks that are coming in, and I really look forward to being in touch with everybody and working together with all of the different partners. So thanks everybody for joining, and we'll be in touch soon.